Right now, we're joined by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. Doc, it's great to see you as always, and thank you for being with us. And you've been a beacon of light through this whole thing. Let me ask you about that. What do you think? A, is something going to be ready by the end of October, or B, by the end of the year? What do you think?
So this is pretty challenging, Ed. What I'll say is many Americans are concerned that Operation Warp Speed will rush to develop a vaccine at the expense of safety and the science. So what's critical is that these COVID vaccines are proven to be safe and effective before being given the green light. Now, we're talking about whether the FDA gives an emergency use authorization. And I think that would be not wise for them because we're still trying to figure out whether these randomized controlled trials prove effectiveness and safety. So if you're someone in my trial and I want to enroll you to the placebo versus the vaccine, but yet I have to tell you that there's also a vaccine out there that I could give you, it presents too much of a dilemma.
Got it.
It's something that everybody's still trying to figure out. 8 communities, Dr. Ellerin, in Massachusetts still considered high risk, even though those numbers are starting to come down. But let's talk about them. A lot of them are north of Boston. Chelsea, Revere, Everett, Lynn, and the state did launch this new awareness campaign today trying to target those specific hotspots. So from your perspective and your expertise, why have those rates consistently been higher in those communities? And do you think awareness is the way to help? It can't hurt, of course.
So let's take a closer look at this, Maria. When you look at these towns and cities, they're often ones that have a lot of racial diversity, a lot of people with chronic medical conditions, a lot of essential workers that have to go to work, and they may not be able to leave work unless they show that they have a positive COVID test. And we know that these tests are taking a long time to come back. So that creates an issue. Also, many of these families live in multi-generational homes. So that combination can be very problematic with COVID-19. What's important is that we really ramp up the testing and do smart testing in these areas where we're seeing cases ramp up.
Let's talk about the issue of ventilation that's come up with schools and fresh air getting in. Now, local experts and researchers say there's a mountain of evidence that proper ventilation does play an important role in preventing the virus. So what are we learning exactly about this?
Really important here. As we're moving from outdoors to indoors, we know that the majority of transmissions are going to occur indoors. We've heard about masking, distancing, washing, but now we have to talk about ventilation. What we want is fresh air to come into these rooms, and we want the old air to be exhausted out. And you'd like air exchanges about 4 to 6 times per hour. Unfortunately, a lot of these rooms don't have that.
Right.
But one simple step is just opening a window. So while we can do this over the next few months, even if you open it 6 inches, that's enough to recirculate the air and diminish that amount of virus that may be hanging out.
Great point, but obviously in what, January, February, March, that isn't exactly practical. December, you know what I'm saying?
So we need to add filters.
Very good, Doc. Great to see you as always.
Thank you, Dr. Todd Ellerin from South Shore Health. Thank you, Doctor. Be well.